Hello, I'm Dr. Niveditha. I'm a physician, and on this World Heart Day, I would like to take this opportunity to discuss on what high blood pressure is and how to prevent it. Usually, everyone would like to have a healthy lifestyle and a normal BP, but what exactly does it mean? Basically, each time the heart beats, it pumps blood into the blood vessels, and there is certain amount of blood pressure or the pressure which is exerted on the blood vessels. So you can imagine a hose pipe wherein water is passed through, and the hose pipe, there is a lot of pressure in the water which is exerting pressure against the walls of the hose pipe. If the lumen of the hose pipe is small and the pressure of the water is very high. So in the same way, even in our body, we have blood which is being pumped from the heart exerting pressure against the walls of our blood vessels. So this there is a lot of variation in our blood pressure throughout the day. So there can be ups, there can be downs, and there can be high blood pressure. But then, if this blood pressure or the pressure exerted over the walls, if it is sustainably high or if it is raised for a very long duration of time, then we call it as high blood pressure. So any blood pressure above 140 millimeters of mercury over 90, anything above this we call it as high blood pressure. So what causes all this blood pressure? There are a lot of factors to increase blood pressure. Like there can be any lifestyle problems like obesity, or it can be alcohol, it can be smoking. So various reasons, or having processed food. So this blood pressure is called a silent killer. So why is it called a silent killer? Is because you might feel that you, even though you're having hypertension, you're feeling any symptoms. You might not be feeling any symptoms. So you might feel that it is not necessary for you to take medications. But it is something like your blood vessels are supplying blood to the vital organs and they are being damaged. For example, you are giving water to a plant through a hose pipe. So if this hose pipe is damaged, it will not supply water to the plant. So the plant dies. In the same way, our vital organs are being supplied by blood through the blood vessels. So these blood vessels are being damaged by high BP. So when these are damaged, the supply to the vital organs is cut off. So it can lead to heart attacks, it can lead to strokes, or it can even lead to your thrombosis all over the body. So it can lead to eyesight changes. So a lot of complications can happen because of increased blood pressure. So it is very necessary that we keep our blood pressure in check. So how do we keep it in check? So it is a disease which can be kept in check and controlled. Like you can do various lifestyle modifications like regular exercise and physical activity. So how do you do this? You can do walking, jogging, or any other structured physical activity like swimming. So the main thing is to have consistency. And because of regular physical activity, even your weight reduction happens, which is a major factor in reducing your blood pressure. It even makes your heart stronger, right? The next thing to follow is healthy diet. So how do you follow a healthy diet? You can include a lot of vegetables and fruits and whole grains, which is recommended for hypertensive patients, and it is very helpful in reduction of blood pressure. There is something called as dash diet. What is this dash diet? It is dietary intervention against stopping blood pressure, stopping hypertension. So what does this mean? So it involves including vegetables, fruits, and whole grains in your diet, so that it helps in reduction of the blood pressure. So because of this diet, you can reduce your blood pressure almost up to 5 to 6 millimeters of mercury. This eventually leads to reduction in your weight, and which results in reduction of blood pressure. And the next thing which you can do in your diet is reduce your salt intake. Your salt intake reduction can even bring down the blood pressure by around 5 to 6 millimeters of mercury. and you start reading the labels in all the processed food, and basically you can avoid, or it's best to avoid all the processed food from your diet. The next thing to do is to quit smoking. So this is, if you're a smoker, this is the right time to quit smoking, because of various reasons like COVID, and also increased blood pressure will lead to very bad outcomes. And the next thing to do could be your regular blood pressure monitoring. So regular blood pressure monitoring, it can even be done at home at your convenience by a home electronic BP recording machine. And the main thing is to keep a journal, so that whenever you are visiting the doctor next time, you can show your notes and your blood pressure recordings to your doctor, which will help in tweaking your medications or optimizing your medications. The main factor, another main factor in your which contributes to your blood pressure is the stress. So stress management is an important factor. It can be done by practicing various calming techniques like meditation, yoga, or listening to music. Take time out every day, a few minutes, to practice these calming techniques. And the next thing to do could be your adherence to medication. So many people who have been started on medication fail to adhere to medications. So they come with complications of blood pressure. To avoid this, adherence to medication is a very important factor in controlling your medication. And if you adopt a healthy lifestyle, which will help you to enjoy a very long and healthy life. So high blood pressure can be prevented as well as controlled in many ways. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you.